So the plan for today is continuing our lower urinary tract disease theme to talk about the most common cause of lower urinary tract disease in cats, which is a condition called idiopathic cystitis. And what I'm going to do in this session is spend a little bit of time talking about, firstly, what does this term mean? What do we understand about this condition? How is it diagnosed? How does it typically present? So what clues of this condition might you see in your cats if they have it? And how is it diagnosed and how is it managed? So that's our shopping list of things to look at today. And at the end, we'll have some time, as usual, for some questions. So if any of you have had experiences of managing this and want to ask any questions, then obviously I'd be delighted to take those. So firstly, let's look at the definition. What is idiopathic cystitis? And I love this quote here, which is actually from a fictional character you may know, Dr. Gregory House from the TV series House. His definition of idiopathic was meaning we're idiots because we can't figure out what's causing it. The official medical definition would be cause unknown. So the end result is the same. Unfortunately, if we give any medical condition this label idiopathic, all that means is we still don't fully understand what has caused this condition. And any of you that listened to the sessions on hypertension will have heard me talk about idiopathic hypertension. So it's a term that's used throughout the world of veterinary and human medicine, and it just means, unfortunately, we haven't worked out the cause. The cause is unknown. And as I've already hinted, it is, in terms of idiopathic cystitis, it is the most common diagnosis, the most common cause of lower urinary tract disease. But when it comes to diagnosis, therefore, you might be thinking, well, how do we diagnose this idiopathic condition, the cause unknown condition? And the answer to that is we have to rule out everything else. So it's a diagnosis of exclusion. So if we're considering this as a possibility as clinicians, then we need to make sure that we're happy that we've ruled out to the best of our abilities possibilities like stones, infections, and tumours, for example, because we can only actually diagnose this condition by ruling out all of the other known causes. So next on our shopping list of questions to answer was what might you see as clues of this condition in your cat at home, or how might your cat present? Now, last week, again, we spoke about lower urinary tract disease in general and the sorts of clinical signs that affected cats show. So things like passing bloody urine, trying to pass urine very frequently, sometimes outside the litter box with pain and difficulty. So all of those things apply to idiopathic cystitis as well. But the ways that this condition typically will present will be one of four possibilities as shown here. So some cats will just have a single episode in their life. If you like, that might be the lucky ones with this condition, that for whatever reason it only happens that one time and they never have recurrent issues. But probably more often in terms of our diagnosis of this condition would be cats that have recurrent episodes. And typically an episode, so a period of time showing these lower urinary tract signs, will be for a few days. So maybe 2 to 5 days of the cat showing this pain and difficulty passing urine, maybe blood in the urine, urinating frequently, passing very small amounts of urine. And that goes on for a few days, and then it actually will get better on its own, but recurring perhaps a few weeks or maybe a few months later. That would be a typical picture. And unfortunately, because these episodes are often self-limiting, they get better on their own. In the early days, so we're talking decades ago now, when vets were trying to work out what's a good treatment for this condition, they managed to persuade themselves that a number of treatments were effective, because whether they gave antibiotics or anti-inflammatories or painkillers, the cats did get better. But one very well constructed study actually included very sensibly the no treatment option, which is the most painful one to consider, of course, as a carer and as a clinician. But basically they showed that no treatment, the cats got better at the same speed of recovery as those that had had any of the other treatments. So therefore we're starting to see, well, unfortunately, this is a condition that sort of runs its course able to hasten a recovery, unfortunately, which doesn't mean not to treat. It just means that, unfortunately, probably for many cases, the treatment, whether it's painkillers or otherwise, may not actually impact on how quickly the cat's going to recover from that condition. Some very unlucky cats will have persistent clinical signs. So what I mean by this is the cat that, rather than having a few days or of bad signs and then everything is okay for another month or two, these poor cats just all the time will show lower urinary tract signs, which of course is very distressing. And then for male cats, another possibility, which we talked a little bit about last week, was urethral obstruction, blocking of the urethra, which is the tube from the bladder to the outside. So the cat now is unable to pass urine at all. And this is very definitely a life-threatening emergency that needs to be acted on very quickly, because it can unfortunately be rapidly fatal. So obstruction in cats with FIC can occur partly due to spasm, or could be just spasm in some cats, but in other cats they can get these, again we mentioned them last week, these things called urethral plugs, which are accumulations of protein and mucus and crystals which can block up the urethra, and that too is thought to be one manifestation of this idiopathic cystitis. So those are the ways that cats may present with this condition. And next we'll talk a little bit about what we know about the cause of this condition, because although it's idiopathic, actually a lot of research has been done, and particularly by Professor Tony Buffington at Ohio State University and his colleagues, and many of them have done really fabulous work to try and understand this condition. And I'll spend just a few minutes talking about what is known so far. Oh, I just see we have someone who's not muted. Let me see if I can just resolve that. I think that's okay. So what causes FIC? Well, it's certainly a complicated picture, one of those situations where many factors are interacting to result in that end result of a cat that is having painful, difficult urination. And the interaction is thought to involve not only the urinary system, but also the nervous system and the endocrine system, the hormonal system in the body, and the cat's environment. So all of these things are interacting in certain susceptible cats to lead to these clinical signs that we see as carers and as vets. And in fact, genetics and early life bad experiences are also thought to be very important, because that's a time when the nervous system and the hormonal system are developing. So if there are problems at that stage of life, whether this is a kitten who is orphaned, their mother dies, for example, and they're hand reared, or whether the mother had a very stressful pregnancy, that can affect development of their nervous system, their hormonal system, and increase their risk of developing this as a condition later in life. People have looked at a number of risk factors for idiopathic cystitis, and that's interesting just to include at this point as well. What you'll see as you glance down this list is that there are some seemingly contradictory risk factors on here. So we've got the single cat and we've also got the multi-cat household. But a common vein flowing through this, which we'll come back to more and more, is actually stress in cats. So this is why more recently some clinicians have started to talk about idiopathic cystitis as being a stress cystitis. And some indoor-only cats living on their own, if they're on their own all day and perhaps their owner works long hours and their environment is not what we would call very enriched, you know, there's maybe not much for them to do, that can be quite anxiety-inducing for them. Similarly, cats that are on multi-cat households that don't get on with each other, that also can cause anxiety. So this is a thread we'll come back to in just a moment. And Tony Buffington and his colleagues also in the last decade have come up with this term for cats suffering from idiopathic cystitis, or many cats suffering from idiopathic cystitis, which you may read. And this is this term Pandora syndrome. And you may have heard the I think it's a Greek mythology story about Pandora's box, or Pandora's casket, where all the evils of the world were let out when that was open. And it's a catch-all term really for this syndrome syndrome, where in actual fact, it's not just the bladder that is affected in these cats, but the hypothesis is actually that this complex interaction between the cat's genetics and its environments, its upbringing, that affects its development of its nervous system and hormonal system, leaves the cat vulnerable to stress, and vulnerable in a way that another cat that was completely healthy would be fine coping with whatever stresses come its way. And life, as we know, for ourselves as well as our cats, you know, there are always little stresses thrown in there. But these cats with Pandora syndrome, because of their genetics and the altered development of their nervous and hormonal system, are particularly vulnerable to stress. But the end result of that is not just cystitis, it's not just lower urinary tract signs, but often these cats, in fact, if you look more closely, have other manifestations of stress that are causing other clinical signs. And so that might be that they overgroom. Some cats will overeat. They may have other systemic signs. GI is our abbreviation for gastrointestinal signs, so things like vomiting, sickness, poor appetite, as well as overeating. So the hypothesis is essentially that these cats with Pandora syndrome, the idiopathic cystitis is just a component of a more generalized problem, and it's just the way that the bladder is showing its stress, is sort of dealing with its stress. And so this is if we want to define this situation further, then what we need to show in a patient is that this is long-term as a problem, so it's chronic as a problem. It's either persisting or recurring over months or years. And as well as the bladder signs, there are other signs that the cat is not completely happy, and that these signs typically are worse when the cat is stressed. But if the cat's in a positive environment where it feels safe and reassured, actually all of those signs of lower urinary tract disease and other Pandora signs can completely disappear. And typically in line with that as well, there are other clues of what I would call an early adverse experience, as hinted at earlier on, those cats that perhaps lost their mother as a very young kitten, or perhaps their mother was very stressed when she was pregnant and it affected the development of their nervous and hormonal system at that time. So all these factors are feeding in, and the end result is that what we would loosely call the stress response system, the ability of the cat to cope with stress, is damaged. And as a consequence of that, these cats, when they're stressed, will show clinical signs of illness, and that typically includes lower urinary tract signs, what we would call this idiopathic cystitis. So very, very also simplified to a massive degree would be this sequence of photos where we have a cat that is susceptible. So this cat is okay if it's not stressed, it doesn't have any urinary tract signs, but perhaps if we do stress it, and I've just added in a small child and a dog to be just, you know, some examples of stressors in a household, for that susceptible cat, that could be enough to trigger an episode of idiopathic cystitis. So that might be for those of you perhaps who have grandchildren. When the grandchildren visit, the cat's very stressed. But there may be other scenarios that are associated with stress that you might recognize in your home. And that would be the very, very simplistic sort of overview of what's going on in these cats. And there are lots and lots of things that can stress out cats, and I'll again show some examples of that in just a second. But key things really are often what we would call chronic stresses, so things that go on for a long period of time, and things that the cat can't get away from. So if the cat feels it has no escape from whatever is stressing it out, then that is extremely stressful. So that might include a new baby in the household, for example, or a new cat in the household, for example. And this cat on the right hand side, just for illustration, this is a cat at a vet clinic, so it's not at home, and the cat's being weighed, it's on the scales, but you can see this cat has its eyes closed. This is something we often see in the vet clinic, and it's not that this cat has thought, well, this is a fabulous place to have a snooze, I think I'll just go to sleep on the scales, which might be one interpretation. If you look very closely at the cat, you'll see it looks very tense, and although it's got its eyes closed, its ear position, its body posture is quite tense and ready to leap into action. And this cat is actually hiding, trying to hide by closing its eyes from a stressful environment, which is unfortunately the vet clinic. So this is something that if if you do see your cat do this at the clinic, unfortunately, it means your cat is trying to cope with the stress by pretending it's not there. So just a few examples of stress for you to look over. And if you do want a copy of these slides, just email and we can send you the PDF. So if you're wanting to take notes, I won't leave you enough time to write this all down now, but do feel free to get in touch. We can send those to you. But anything really that you think might cause stress in your cat should be added to this list if it's not already on it. So again, a video here that may not completely play smoothly over the internet, depending on how we're doing this afternoon. But this is one of my friends and her cat in her garden, and this is in Edinburgh, where we both live. And the weather is not this bad today, although it's definitely not blisteringly hot either. But this cat has gone out in the snow, and it soon becomes apparent this cat is desperately trying to find somewhere to go to the loo, to urinate. And you can see the cat is trying to sort of crouch down a bit and thinking, well, I don't see much snow in Edinburgh. Perhaps, you know, this cat's not seen snow before, and it's not very happy to squat and urinate on the snow. So it sort of starts to position and then obviously decides this is not much fun. And eventually, actually, it does pass urine and all is well. But the key message for this would be, of course, this cat, it would, in my opinion, in many ways, be entirely justified if it decided, well, I'm not going to go to the loo in the snow. If I haven't got a litter box in my house, then I'll just have to find the best possible option in the house. That might be someone's bed, or it might be a bit of carpet. So, you know, the message from this video was to say to my friend, look, you need a litter box. When the weather is bad, your cat needs somewhere suitable to go. So how do we recognise stress in cats at home? Well, it's not always easy, but if you do have multiple cats in your household, and if any of them do develop urinary problems that are diagnosed as idiopathic cystitis, then it's useful to look at those cats closely and how they interact, and try and work out, for example, in your multiple cat household, how many social groups of cats do you have? And social groups of cats are groups of cats that are happy with each other, so the sort of best friend cats in the household. And to do that, a useful exercise is to firstly explain to you what to look out for in your cats, and secondly, to then observe your cats for these behaviours. So I've put a green box around these behaviours. These are what we would call affiliative behaviours. These are positive, friendly behaviours that cats might show towards each other. So they include sharing food bowls, sleeping, touching each other, grooming each other, rubbing each other, nose-to-nose greetings, playing together, and lastly, this chirruping noise that cats will often greet each other with, this sort of noise that when they see each other or when they see ourselves, they sometimes do this as well. So that's all positive. That's sort of tending to say, I like you. On the other hand, we have situations where, of course, cats don't get on. And a key take-home message from this is that often, actually, if cats don't like each other, it's not very obvious. They're not going to fight with each other every day, because fighting is potentially going to hurt them, expend a lot of energy. So they're going to find ways of dealing with it. And that might be just avoiding each other. So if one cat can be upstairs most of the time and one is downstairs most of the time, or they can work out with each other which times of day they're in which areas, then they'll do that. They might choose to, if they don't like someone, block their access to some resources in the household, like a food bowl or a litter tray. They occasionally might hiss or growl, but often that doesn't happen very often. And even less often would be actually lashing out or fighting at all. So again, the key message is that often if there is disharmony, it's very subtle. You need to look quite carefully. So having understood what to look for, if you've got a multiple cat household and you're wanting to understand, well, how many social groups of cats do I have in my household? The next useful thing to do is to write their names down on a piece of paper and observe them. And when you see positive affiliative behaviour shown from one cat to another, you draw an arrow, and I've shown an arrow in green in this example. So Twizzle nudged Sooty, so that was a nice green arrow, and Sooty groomed Twizzle, so that's a green arrow going back from Sooty to Twizzle. Unfortunately, Hobie, who was the newcomer to the household, didn't get any love from Sooty or Twizzle, but also gave negative vibes to both of them. So in this household of 3 cats, we've got 2 social groups. Sooty and Twizzle, happy with each other, love each other, get on fine. Hobie is on his own. So we need to make sure we have enough resources in our house so that it's not possible for Hobie to prevent Sooty and Twizzle from accessing resources, or vice versa. And just pictorially, some examples would be on this slide. So the cats that love each other, having that lovely cuddle and groom on the sofa, they're in the same social group. But on the right-hand side, these cats, although they're quite close together, it was a very busy household with lots of cats, you can see they're sort of all looking in a different direction. They're perhaps trying to pretend they're not in the same airspace as each other. They're not particularly best buddies. Another useful resource, which I won't let play in full, but this is a video which the UK charity Cats Protection did. And if you search Cats Protection, friend or foe, you will find this video. And it just goes through what to look for, as exactly as I've explained, actually, in terms of signs that cats are friends versus signs that they're perhaps not friends. And the video finishes off with some advice on how to provide resources in such a way that everybody is happy. And it's probably just a couple of minutes long as a video, but as I say, I won't play it for you now. So back to how do we manage idiopathic cystitis now? Well, as I said very earlier on in this presentation, we often find that cats have these self-limiting episodes. So if your cat is in that category, you know, typically they will have signs for maybe 1, 2, 3, 4, 5 days, and then it will get better. And as I mentioned earlier on, there has been some research that has shown that, you know, it almost doesn't matter what treatment you give them, they will get better. However, many clinicians and obviously many owners, when their cat is in distress in an episode, would want to do something rather than nothing. And certainly giving painkillers is, I think, a nice thing to give to a cat when it seems to be uncomfortable and distressed. But more importantly would be those cats that obviously that have any evidence of urethral obstruction. The blocked cats, they definitely need the emergency management, which might include antispasmodics, medications that relax the muscle of the urethra to allow urine to pass through, and or catheterization if there is a urethral plug, for example. Then we need to move into the chronic or the long-term management. And the important thing here is wanting to minimize the risk of future episodes where at all possible. And the steps that I tend to follow for these sort of cases would be the ones that are listed on this slide. So looking at the home and the environment, what can we find about that that gives us a clue of perhaps stressful things? And if there are stressful things that we can find, perhaps we can sort them out. So maybe the cat's litter box is in a very noisy or busy part of the home and it finds it quite stressful using that litter box there, or it's in a conservatory where the cat next door likes sitting outside and watching the cat, and that is stressful for it. So those sorts of things can be helpful. Increasing water intake is also thought to be very helpful for managing this condition and many other urinary conditions. So that, in fact, is what we're going to talk about next week. I won't talk about that at all today. There are some dietary considerations which I'll briefly mention as well. And then for those cats where we still haven't really succeeded, there are some other medications that we can try. And in general, the principles for these cases is from a stress perspective to minimize vet visits as well. So these are cases where I like to have close contact with the carer over the phone, over the internet, to discuss progress rather than wanting the cat to come into the clinic too often, because stress coming into a clinic could potentially precipitate an episode as well. So in terms of the first step, looking at the household and the home environment and stress there, the strategy that this is part of is one that's called MEMO, which stands for multimodal, environmental modification. And this was a term coined by Professor Tony Buffington, who I mentioned earlier on, who's very much a guru in idiopathic cystitis, has done a lot of work. And he published a paper about 15 years ago now, where he followed this strategy with really, really severely affected cats, cats where the owners were sadly considering euthanasia because the cats were suffering so badly from this condition. And it had thus far been so difficult to manage them. And so they embarked on this very detailed plan, which really involved him educating the owners about the condition in the same sort of way that I've spoken about it today, and really empowering them to make changes in the household which might benefit the cat in terms of its stress levels, and also understanding things not to do, like of course not to punish a cat if it urinates outside a litter box, for example. We don't want to increase the stress. And increasing the cat's water intake was part of the plan as well. And what he found was that if you do really focus in on this and you follow this strategy, and it's also outlined in detail in a book that I wrote with Professor Danielle Gunmore, which is available on the website, and there's a picture of the book cover there for you as well. And what he found is that if you follow that strategy, actually, even with these really, really severely affected cats, he was able to cure almost 3/4 of them, and the remaining 25% were very much improved to the extent where no longer was it necessary to think about euthanasia. So really fabulous results, but it does take a lot of hard work. And the first step is to look in the cat's environment, try and work out how can we de-stress life for the cat, and particularly multi-cat households, it can be challenging. So this is another photo from the same household I showed you a photo a few slides ago. The cat's not in the same social group. You can see it's a pretty busy household. There are a lot of cats, and it is quite difficult to have a lot of cats in a small space and them all to be quite happy with each other. So actually, it may be sensible in some situations to even think about rehoming to friends and family to try and cut down the number of cats if you're in this sort of situation. And looking at the environment in general, really to try and find ways of de-stressing things as best as possible. Also, sometimes it can be helpful as a carer to be aware of what I would call prodromal signs, particularly those cats that develop spasm. If you can see that they look like they're coming into an episode, then sometimes actually you can avert an episode medically. So the cats that are vulnerable to spasm, if you see them suddenly starting to overgroom their back end more, as per this picture, but this lovely expression, the cat playing the fiddle, then in a cat vulnerable to spasm, giving an antispasmodic medication and perhaps some painkillers at home, so again, try and avoid that vet visit, sometimes will completely avoid that episode from ever developing, which of course is good news. Not always possible, but when it is possible, that's great. And then we want to look at the social groups and resources. So as we talked about a little bit earlier on, if you've got multiple cats, trying to work out, well, are they friends? Can they share things? Or do I need to make sure that I've got more resources than that in the house? So make sure one cat can't block access to any of those key resources for another cat. And the key resources, as listed on this slide, include things like food and water, rest areas, hiding areas, litter boxes, scratching posts, and toys and things as well. We'll talk more about litter boxes in 2 weeks' time when there's a presentation about periuria, urination outside the litter box. But just very briefly here, of course, it is relevant to these cases as well. So in general, the cat's preference for a litter tray is firstly that it's big in size, ideally 1.5 times the length of the cat if you measure it from their nose to the base of their tail. So generous in size so they can get in it, move around quite happily, and there are thankfully some good big litter trays available these days. Cats tend to prefer a sandy consistency litter, and a clumping litter is often good because it's easy to keep clean, but also as an owner then you know exactly what your cat is passing, and so if you can see one day, oh gosh, my cat hasn't urinated, you know about it very quickly, which is great. Feliway, also, you will probably have used Feliway yourselves, and I'm sure have some experience at least of the Feliway Classic, which is the original Feliway, and this can be of some help help. I think it's not on its own, it's not going to cure the cat, but as part of an overall approach to reduce stress and provide reassurance to the cat, it can be very helpful. For those of you that are less familiar with Feliway, it contains a synthetic feline pheromone, and the pheromone is this chemical which we can't smell, but cats can smell, and they produce it in their cheek glands, and when they rub on your legs or on the wall or on each other, they're rubbing this pheromone onto surfaces, and that's saying, yep, I feel okay here, this is a nice place, I feel calm, I feel reassured. And we can get Feliway in this synthetic form as a diffuser which you plug in as per the picture, and you can refill it. It lasts about a month and then you need to change it. There is also a Feliway spray, which mustn't be used directly on the cat, but is quite helpful for your cat carrier before you put your cat in it to go to the vet clinic, and will also help to reduce their stress levels. More recently, Seva, the company that developed Feliway, have developed a new product called Feliway Friends, and this can be very helpful in multi-cat households where there is tension between cats, and it's called the Harmony marker or Harmony pheromone. It's produced in a natural situation by the mammary area of the mother cat, so that when the baby cats are all having their milk, they're not thinking about fighting with each other. So it helps to just ease any tension and conflict between cats in the same house. And it definitely can be helpful, again, as part of a picture. Water intake I mentioned, but we'll talk about that next week, so no more on that now. Other dietary considerations? Well, in general terms, we of course want to minimize the possibility of obesity. That's one of the risk factors for this condition, and is risky for other health issues in our cats. So that may be a feature. But from an idiopathic cystitis perspective, again, other key things would be wet food where possible, because we want to encourage that water intake, that fluid intake, as we'll talk about next week. And we want to also consider boredom in cats that are indoor only. So the reason to put in the Doc and Phoebe hunting kit there is just an example. There are lots and lots of different examples, but of an interactive way of feeding cats. So rather than just leaving a bowl full of dry food, if your cat does like their dry food, perhaps make it a little bit more interesting by hiding the food in these little mice that the cat can play with, and it perhaps takes longer and occupies more of their time and provides them with something to do through the day, which can be interesting for them as well. There are some therapeutic diets, some what you might call a prescription diet for urinary problems in cats, and some of these are aimed at cats with idiopathic cystitis as well. I've just got 2 pictures here, but there are more than I have included here, and not displaying any sort of allegiances to companies, but just to show you some examples. And some of these diets are orientated primarily at urinary tract health, so minimizing stone formation, tend to have extra glycosaminoglycans, which are proteins found lining the bladder, although it has to be said there's still controversy as to really how effective that might be as part of the management of lower urinary tract disease in cats. But also more recently, many of these diets have included a sort of stress or anxiety alleviating component. So you may have heard, for example, of Royal Canin's Calm diet, Hill's CD stress diet, and both of these contain nutritional supplements that actually have an effect on stress in cats. So the L-tryptophan, as listed on this slide, interacts with the serotonin receptors, so has sort of similar happy feelings as a result of that. Milk hydrolysate, alpha-casosabine, interacts with one of the GABA receptors, so again can have anxiety alleviating impact. We need to again think about these things as part of a bigger component of our management. So we don't want to feed a calm diet to a really stressful household and do nothing else about the stress. It's obviously part of the picture. But certainly I have anecdotally lots of owners who really think that these diets have helped their cats and helped their idiopathic cystitis going forwards. Certainly as well, if you have a cat that really is a dry food addict, will not eat a wet diet, and it has idiopathic cystitis, then of all the dry diets to give it, I would be more inclined to use a therapeutic diet with these sort of beneficial effects. I think there is justification for that. And in most of the cats that we see, all of those strategies that I've covered so far are sufficient to get you good resolution of clinical signs. There are some cats where still, in spite of doing all of this, we have recurrence, we have problems. And other options to consider might be, if you're not using a diet that's supplemented in those glycosaminoglycans, you can use those as very definite supplements. So things like cystes would be in that category. There are also, you can have L-tryptophan as a supplement, and that alpha-casosapine, those anxiety relieving nutritional supplements I mentioned in the diets. You can administer those orally as well. There are capsules available for those. And there are what I would call bigger gun drugs as well, which are not licensed, so they're not veterinary authorized for this use in cats. They are either authorized for other species, so that clomipramine is an example of a medication which is licensed for dogs, and falls into this sort of more antidepressant category, but it's a big gun to use, and so we try not to go down that pathway if we can possibly avoid it. But certainly those options are available for those very, very refractory cases. So in summary, it definitely can be a challenging condition to treat. Some poor cats just, I think, are very vulnerable and really struggle with this condition. And often it's the environment is really the key thing to focus on, looking at that cat and its behavior and trying to support it so it feels reassured and safe, but also able to escape from you and or other animals in the house whenever it wants to, as part of its sort of stress management, stress coping mechanisms. And often you can get good results, but it does take hard work sometimes to find what works and what doesn't work in that individual cat. Water intake, definitely a key part. We'll talk about that next week, as I've said, and a small number of cats where we do need to try bigger medications to see if we can help them. And probably the last thing that I would mention as a strategy is, again, in some of those very, very severely affected cases, if we can't provide resolution in the home that they're in, then actually sometimes it is worth considering rehoming to a different household. For example, you know, if you have cats that don't get on and you've provided a massive resources to try and make life possible for them to live alongside each other in harmony, but it just isn't working, then sometimes the kindest thing is to try and find a different home. And testing that out with a friend or a relative that has no animals can be a useful first step. So if you do a temporary rehome to them, and if all the signs of lower urinary tract disease disappear, then you know, well, this is something that might work as a long-term. That's going to be a difficult thing for many people to cope with, because you never want to say goodbye to a cat that you love, but sometimes, unfortunately, it is necessary. So I hope that has been helpful, and that I've been able to provide you with some information on this challenging condition. Again, just a reminder of some of the other resources that are available through the website, and don't forget the other Cat Cafe sessions that have already been recorded, as well as future ones coming up. We've now got a page accessible via the video tutorial page on the website, where you can see the full timetable of what's coming up, and obviously I'll add more to that. I think it just goes up till probably the end of July at the moment, but more topics to be added. And if you do have suggestions, please feel free to send them through. And also, again, if you want a copy of the slides, again, just send an email requesting that and we'll be able to do that. Thank you very much.